a thickener will be added. It makes it easy for them to swallow. We talk about that. We talk about one who has problem with their vision. They can't see well or they are totally blind. You'll be using the clock to feed them. The clock. Even though the person is blind, but they don't want you to spoon feed them. They can use their own hands to feed. But they can see. So you'll be using the clock to tell them the position of items on their meal trays. Here your water is sitting at 3 o'clock. The mashed potato and gravy, they are at 6 o'clock. Your orange juice is sitting at 9 o'clock. So that they will go to those different positions and pick up whatever it is for them to feed themselves. For one who is visually impaired, you'll be using the clock description. We talk about that. If you go to work and you have never taken care of somebody before, it's your first time, they move you on a strange floor. There are two ways that you can identify them. You grab the meal card. If they have a wristband, you compare it. If not, if you call them by their name and they respond to that, then you know that's the person. Or the third way, you can ask your coworker, I'm looking for Theo. And they'll point at Theo for you. These are the three different ways you can identify somebody that you have never taken care of when you go to work. Good. We talk about this meal card. Their diets are ordered by their doctors. The meal comes from the kitchen with a card, a menu card. Check it out to make sure it's the right person and it's the right type of diet. Compare what's on the meal card or the diet card with what's on the tray. Make sure everything is good and correct. Then now you pick this to go and feed. The state examiner will be watching for that when you come in. Pick this up first. Check it out. Make sure everything matches. Then you go and deliver or you feed. We talk about that in class. Let's watch the first video clip. Serving meal tray. Go in the room, clean up the room. You would have done that because if you work the morning shift, you have to tidy up their rooms when you get them out of bed. Empty the trash. The room should now appear like a bathroom. Then you go and deliver the meal so that they can have a pleasant experience while you feed them in bed. Or even if they're going to be feeding themselves, they will have a pleasant experience in the room feeding.
Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program. When preparing for a meal, plan to prepare the environment and the patient so that the meal will be a pleasant experience.
Good afternoon, Mr. Lind.
Good afternoon.
Let me check your bracelet. I'm going to get you ready for lunch.
Okay.
I'm going to clean off your tray here.
Okay.
First, prepare the patient's room for mealtime. Clear his overbed table to make room for his meal tray.
Let me clean this table off for you before we get your tray.
If needed, clean the surface of the table using a paper towel. Check the environment for distractions and reduce the noise level if possible.
Will you need to use the urinal before lunch?
No, I'm fine.
You're okay?
Prepare the patient for his meal. To do this, offer assistance with toileting and hand hygiene as needed. If you must empty the bedpan or urinal or change soiled linen or clothing, be sure to wear gloves.
Thank you.
All right. I'll be right back.
Okay.
Offer him the use of a toothbrush or mouth rinse.
Before lunch,
Anybody
how
still
about
have,
if I let you
test
rinse your
results?
mouth out?
Anybody
All right.
test results?
Just take a couple of swallows and swish it around, and then I'll have you spit in the basin.
Position the patient for safe eating. For a patient who can sit up, help him into non-slip shoes. And, if permitted, Assist him to a comfortable chair.
Is that okay?
Fine.
All right, on my count of 3, we're going to stand. Ready? 1, 2, 3. Very good.
Allow the patient to regain his balance after standing. If the patient can't sit in a chair, use a Fowler's or high Fowler's position if his condition allows. If you will be assisting the patient, set up chairs for both of you.
Watch your feet.
Can I have my glasses on?
Help the patient put on glasses or insert contact lenses, and put in dentures or hearing aid if used. Check that his dentures fit properly. After performing hand hygiene, serve the meal tray. Identify the patient using his ID band. Check the tray for completeness and accuracy by comparing its items against the dietary card or menu. Foods should match what has been ordered and should be served at the correct
Okay, looks
temperatures.
like you have what we're supposed to have. Feels nice and hot. That's good.
Prepare the tray. Based on the patient's needs, open cartons, remove lids, and cut the food.
We have some special utensils that'll make it easier for you to eat.
Okay.
Make sure that the tray has adaptive devices for feeding if needed, such as a two-handled cup with lid, a plate with a plate guard, and utensils with splints or enlarged handles. If needed, use additional adaptive devices, such as angled forks and spoons with grip openings in the handles, utensils that can be adjusted to the patient's grip strength, utensils with tapered and angled handles, and cups with thumb grips. If required by facility policy, put on gloves before handling the patient's food. Season the patient's food and butter his bread as he desires and as his diet allows. For a patient who can eat independently, simply show him how to use any adaptive utensils.
All right.
Briefly observe his technique for self-feeding and his use of the utensils.
I'll be back in a few minutes to check on you.
Okay.
If the patient has no difficulty with swallowing or feeding, plan to check on his progress frequently. When the patient has finished eating, assist with hand hygiene and
Yes,
oral
ma'am.
care.
All right, I have something for you to wash your hands with.
Okay.
Help him into a resting position. If he's prone to aspiration, place the head of the bed at 45 degrees and have him stay in that position for 30 minutes after the meal.
Thank you.
It's important that you leave the head of your bed up for about a half hour.
Okay.
Make sure the call light is within the patient's reach. As part of your follow-up care, note the amount and type of food eaten. Record fluid intake and output or calorie intake as ordered. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.
Okay.